Today's dental patients view dentists as commodities, as interchangeable cogs in a big gear system. Way too many of them are interested primarily in price and whether you take their insurance. Competing on price is a very quick race to the bottom and will threaten the future of your private practice. Now, when we come back, I want to tell you how to change your dental prospect's perception of the value that you provide. I'm Colin, Receiver, founder and CEO of SmartBox, and this is the Patient Attraction Podcast. Now, if you want to grow your practice, you have to move yourself out of the dental commodity category. Your prospects have come to view you as different from the rest. You're more of an expert, you're more trustworthy, you're more relatable to them. Now, you can accomplish those things once you have a patient in your chair. But first, you've got to get them in your chair. Now, what this means is changing your prospect's view of the value that they'll receive by choosing you over your competitor, the guy down the road, the corporate dentist. Now, you're not going to do that by offering money off coupons or freebies because your competitors are doing the same thing. Your dental prospects want to know three things from your marketing. One, do you understand what they're going through? Too many dentists talk about dental issues as if they're talking to other dentists. And this is one of the biggest problems I've seen in dental marketing for the past 2 decades. Most dental marketing is more attuned to attracting dentists than it is to actually attracting patients. Patients don't have malocclusion. Their teeth don't meet properly. They don't have periodontal disease. They're embarrassed to smile. They're in pain. They have constant chronic bad breath. Now, the second thing that patients want to know is whether you can help them. Most of them don't care about the specifics of the procedure. They only want to know that you can help them to eat, to smile without pain, without embarrassment, without being self-conscious. And here's the third thing. Whether they can relate to you as a person and not just as a guy with DDS or DMD after his name. This is another area where too many dentists fall down. Their website bios are a list of degrees and trainings and publications. And to a dentist, to somebody in the dental industry that understands what that alphabet soup means, that's very impressive. You know, we all know what you had to go through to get those accreditations and to continue furthering your education and your clinical skills to that point. But those don't tell your prospects what it'll be like to have you as their dentist. Those are the 3 things that your prospects value most in their dentist. And if your marketing helps them to see the value in choosing you to solve their dental problems, they're going to come see you. Now, changing someone's perception of you, it's not a 1-week proposition. It's a long-term proposition. But when you show them the value that you provide, you're going to get more and better patients, ultimately more profits. Now, if you want to see how Dr. Ron Receiver, my father, turned his practice from $900,000 a year to almost $3 million in about 7 years, and he hit $2 million in just 5 years, and he did it without selling like a used car salesman. Check out doublecollectionswithoutselling.com. Join me for the next podcast when I'll tell you how to build trust with your prospects. Until then, keep moving forward.